really just kind of getting our ducks in a row. We just saw the vaccine yesterday. It just got the emergency use authorization, the EUA, over the weekend. So the version of the vaccine that we got, the Moderna version, wasn't even available really until Sunday.
We'll do what we can to get the vaccines and do community vaccinations as we're able to, and we'll participate in the planning stages, and when we're able to bring it into our practices, we'll look at doing that.
So there's no actual COVID or coronavirus component to the vaccine. Asaf Tak is my name, and I'm the director of pharmacy at Calais Regional Hospital. Both the Pfizer vaccine and the Moderna vaccine have shown about a 95% effectiveness, which, as far as vaccine numbers go, is incredible.
Well, we're seeing an uptick in cases, and it is primarily, we're guessing, driven from probably family functions and gatherings that were held over Thanksgiving. We've definitely seen an uptick in the county. Our guest today is our director of pharmacy, Asaf Tak. He is the one that is leading our vaccine team. So I know that there's a lot of questions going on with the vaccine announcements in the news lately. So I thought maybe he could come and speak to that and where we are as an organization.
Well, so one of the big things that we'd really like to emphasize right now is that the vaccine is in a phased distribution. So the Maine CDC and the federal CDC is really looking at vaccinating phase 1A at this time. So our hospital employees who have direct contact or may have an increased risk of coming in contact with the coronavirus or COVID-19 are in the priority group of getting the vaccine. So it's not available to everybody at this point, but we are looking at getting our staff vaccinated as soon as we possibly can. I think the big thing is getting it when it's available to you and really encouraging everybody to get not just this vaccine, but all vaccines. There is a lot of misinformation and a lot of unknown about this, and it does cause some worry between a lot of people. But I'll say just from experience, the more that I've read about it and more that I've done research about the vaccine itself, it's put me at more ease and willing to get it, and I'm excited to get it for myself and be able to protect not just myself, my family, but the whole community.
You know, a lot of people want to ensure, because it's a 2-dose vaccination, you know, they want to ensure if they get the first dose, we're supposed to get the second one in around 28 days, that's going to happen. So that's been part of the CDC planning. I think we've had some questions on whether people will need to continue with masking and things of that nature afterwards, which we will, because just because you don't come down with it, you still carry the risk of transmitting. So it's an extra protective layer. It's not one that takes the place of. So we'll still need to social distance and wear our masks and sanitize and do all those things we do. This is an addition to. So we need to continue, but we do need to think of it as a building layer. Like when we first started, we weren't all masking, but then we went to masking. You know, it was more about just sanitizing, and then it went to social distancing. As we learn and as things move forward, we add new precautions, and this is an additional precaution. So it's not something in lieu of, it's something that you'll do in addition of. And it isn't just about protecting yourself, it's building resistance and protections in for our community, our families. So the more people that get the vaccine, the more people are protected, even out of the ones that don't get it. But we have to reach a certain threshold of community members getting the vaccine to make it truly effective and allow us to come out of a lot of these conditions that we're having to do to be safe.
The first part to that about getting your second dose. So the CDC and Maine CDC is reserving the same amount that they gave us for our first shipment for the second dose. So anybody who receives their first dose has a vaccine dose for their second dose available to them. So there really should not be any worry about not getting your second dose if you got your first dose. So the Moderna vaccine, which is the version that we are getting, has been shown or is showing some promise, and they're looking at that in a continued study of the decreased risk of transmission. So once you become vaccinated and get your second dose, and a couple weeks after that, when it kind of takes into full effect, you have a decreased risk of transmitting it to others, which will then allow us to potentially drop masks at some point. One of the big things that they do, again, want to encourage is just because you've received the vaccine doesn't mean that it's available for everybody to receive their vaccine. So while you may be protected against that, they not everybody in the community is yet. So at this time, the recommendations, like Dee Dee was saying, about all the hand hygiene, all the washing your hands, sanitizing, wearing your masks, social distancing, are still very important until we can get to a point where we have enough vaccines for not just hospital staff or long-term care, but for all of our general community, and then we can have the potential to really go back to our normal lives, hopefully, would be the ultimate goal.
Yeah, I mean, it's a staged in process. Within each phase, there's further priorities. So as each group, and they're going to take the higher risk groups or most essential, direct caregivers first. That's why, employees that are at highest risk are getting it. But it's going to be phased in, and it's going to take many months to work through all, even within our small community. So as we go through that process, but in the meantime, our initial safety precautions will need to stay in place. We'll provide information as it comes out, but we're a ways away before we get into general community vaccinations. We'll be following CDC directives on that, so that's not even, that's not decisions that we're making. As they roll out and say that it's available, then we'll take part. We've been taking part with the state planning as far as even just getting to this part. I mean, I know ASOF's been sitting in on the Zoom meetings with the state CDC group to make plans for getting this phase 1 done, and then we'll continue. And now they're starting to look at how we might be able to do community vaccinations. But we started meeting about employee and medical care and first responder vaccinations 4 or 5 months ago.
Yeah, it's been a few months at least.
They just started last week holding meetings that were specific to what community vaccinations might look like. So if that gives you any kind of idea how far out that we're probably looking. But we'll take part. We'll do what we can to get the vaccines and do community vaccinations as we're able to, and we'll participate in the planning stages. And when we're able to bring it into our practices, we'll look at doing that. It's just, we have to follow the process. We have to look at the vaccines as they come out. I mean, Asaf can speak to the Pfizer one. We really aren't eligible for it. It requires equipment that we don't have here. The Moderna fit us a little bit better, and as new ones come out, then we'll continue to evolve and go with the planning.
Long-term care facilities were kind of in the same phase, and what the Maine CDC has done is they've reached out to either local pharmacies or some of the chain pharmacies and contracted with them to be able to provide that vaccine for those locations. They've been part of that same state planning that we've been involved in as well.
Nursing home residents and first responders or direct patient care, I believe, is where we are right now as far as what vaccine is being released for.
Really just kind of getting our ducks in a row. We just saw the vaccine yesterday. It just got the emergency use authorization, the EUA, over the weekend. So the version of the vaccine that we got, the Moderna version, wasn't even available really until Sunday. So Monday, when they shipped them out to all the locations, is really the first chance we've had. Just last night, the CDC's put out some guidance on what the provider standing order needs to look like and some of the requirements on that. So just some of the logistics on some of that. There's some reporting requirements that we have to do back to the state because they're really kind of counting every single dose of these vaccines very, very closely. So there's a lot of work that kind of has to go on in the background at the same time to make sure that everything is kind of ready to go with no hiccups is what we're looking for.
So we expect, even with the holiday in this week, we expect within a week so that we'll have our first doses done, and we'll work through our staff.
We have set up a new email address that anybody can send questions into. We've done 2 Q&As, I think, that we've gone back out to the staff members with a compiled list of questions with some answers that we've got to be able to kind of answer some of those questions that, I saw this or I heard this from somebody, just to be able to get some information from that side. So Dee Dee and I have talked about potentially getting that out to some of the other the FQHCs, the Rural Health Centers, some of the other medical places that may be getting the vaccine sooner than the community, to let them ask some of those questions as well, where we have some of that medical expertise here and available to us to be able to provide that to the community and be able to present and provide that information out for everybody. And then when we get out to the community phase, to be able to provide some of that information out to the community as well.
Yeah, questions will change as depending on what product people are getting and stuff, but Asaf's done a great job of trying to educate our staff on what form of the vaccine we're getting and any information that they might need. So we're really, hoping that they take that all in and read up on it to make the decision on whether they're going to take part in vaccination.
Well, I mean, I think the biggest thing is the unknown. It's a new vaccine, and it's a new disease. The unknown is really the biggest thing that has been the biggest concern for a lot of people. And with the EUA just coming out, a lot of the information isn't or hadn't been previously available to everybody, and now it's really kind of coming out and people can kind of see some of that information for themselves. And I mean, there are lots of questions with it, and I think there's lots of good information out there, but there's also lots of incorrect information out there. So the biggest place that we can get some of that correct information is both from the Maine CDC and the federal CDC, and they've both done a pretty good job, a very good job actually, of getting that information out to anybody who wants to go and read
both of those both of the CDC websites have vaccine-specific information right now, so they have information on both of the vaccines that have made it through the final process so far, and I would expect they'll continue to add information as more vaccines are approved.
Unlike the flu vaccine, which uses inactivated cells of the virus or inactivated virus particles, this vaccine doesn't. So there's no actual COVID or coronavirus component to the vaccine. It's all kind of lab-driven. It's an mRNA-based protein. So it allows your body to kind of create that the spike protein on the coronavirus and lets your body develop its own defense against it.
The medical science people just love it.
Yes. Both the Pfizer vaccine and the Moderna vaccine have shown about a 95% effectiveness. So the Pfizer vaccine was just over 95. The Moderna vaccine was 94 point something, which, as far as vaccine numbers go, is incredible. It has shown very significant promise to severe disease, where I believe both in the Moderna and the Pfizer versions, it has taken severe disease down to 0, which would be your severe hospitalizations, your ICU beds, those things that we kind of worry about over the last months, with the hospitals filling up and being on ventilators and not having enough equipment, not having enough staff, not having enough beds. So a lot of that stuff has the potential to go away after being vaccinated. There are still instances. I mean, it's not 100% because nothing really is. And like Dee Dee had said, it's another layer of protection for those who have received the vaccine. But it really is showing promise in preventing some of those severe complications.
So even if you get vaccinated and it doesn't prevent you from getting COVID completely, it should at least reduce the effects of it. So you have a mild to moderate episode of the disease versus severe to worse. We just have to remind everyone to continue to follow their safety precautions. Wear your mask, wash your hands, watch your distance, try to limit crowds, especially indoor functions. I know that you think family, but we really need to try to limit all of that and continue to follow the safety precautions for the health of our family, not just ourselves, but the health of our family and those that are highly susceptible, and to the health of our community. We're the only ones in control of stopping the spread. Our team managed to pull together. We pulled in extra people. We opened up an extra swabbing station, and we still have to do some curbside. We try to keep anybody with severe symptoms outside of the building, so we still do some curbside, and then just try to divide everyone up in that manner. But it's gone well, and it ensures that we'll be able to continue testing every day that we're open, and it won't be dependent on weather. With that being said, I do want to say during the holiday week, so Christmas week and New Year's week, this week and next week, our testing site is only open Monday, Tuesday, and Wednesday mornings from 8 to 10 a.m. We'll be closed on Thursdays and Fridays for the next 2 holiday weeks. After the New Year, right now, as far as we know, COVID is an ever-changing beast, and we just have to roll with it as we go. But we do still plan to be open Monday through Fridays, 8 to 10 a.m. We're seeing, spikes all over the place, and it's gotten into some areas and schools and workplaces and such as that. And a lot of it is we continue to see people coming in testing positive that are asymptomatic. We continue to have people come in to just randomly get a test because they have a medical procedure coming up and finding out they're positive. So that's why it's important, because they had no idea, but they were spreading and giving that community transmission. And then you also have those that may be showing symptoms, but they just kind of are quiet about it and don't really say much. So it's just really important to segregate yourself off if you have symptoms, but to always follow your safety precautions, because you could be transmitting the virus and not even aware.
And part of the concern with that is it may be just a little sniffle or a sore throat for you, but it may be devastating to someone else who is more susceptible and may have a different reaction to that.
Yeah, we're seeing, a different range even within the same household. You have one that shows no symptoms, you have somebody else that shows severe symptoms, and others that are in between, and they were all probably exposed around the same time. It's different for every person, so it gets really difficult to say that it's not anything that could be devastating, because it might be for you, but for the person sitting right next to you, that could not be the case.